the structures here, okay? Here, this right here is the angle of the mandible. This is the masseter muscle that's sitting on top of that, if you remember that. Okay, right here, we're gonna have the three glands. They're the three salivary glands. This one here that looks like a bean, okay, that one's your submandibular gland. Okay, so that's submandibular. This one right here, that's a little bit smaller, and there's another little piece of it right behind here. Okay, this is going to be your sublingual gland. Okay, and this here that has the duct that comes off of it right here is your parotid gland. This is just a piece of it. As I was telling them, the parotid gland in humans sits right on top, right here. Okay, on top of the masseter, right before the ear. But notice that there's a bigger separation between their ear and their jaw, right? So they're going to have the parotid gland in this area. Remember that for glands, what you're looking for is kind of that chunky structure, just looking like kind of chunky. This one's a little bit more organized, but this one's a little chunkier. So you can see that. And then you can see the facial artery right here, which goes right into the external jugular, so that's kind of interesting. Okay, the facial nerve, I don't know what Jason did, but he cut it off.
Because that's in our lab manual too, to identify facial nerve.
Yeah. Let me see if I can get it. Let me see if I can get it on. Maybe I can get it on this side. That's why we're bilateral animals. Yes, we have two sides. So we just, basically when you're doing this dissection, you just want to make sure you keep yourself very superficial, so that you don't go deep, deep, deep. Not that there's a whole lot of space to go deep, because there really isn't. Did I just break it?
You can even see me.
Yeah, I think I cut it too. I think it's this one here. That seems very superficial though, but I don't see it anywhere else, so I see that one. But here you can also see a little bit more of the parotid gland. I know it's kind of diffuse. It's really not like as a structure, as together a structure as you would think it is. Really just kind of spread out. Okay, so that's definitely part of it right there. That's the parotid gland. You see it looks kind of chunky. Yeah? Okay. So we'll just leave that there for the parotid gland on that side, but the facial nerve, I cut it again. Alright, so in here, okay, the other structure that you want to make sure you look at is you want to make sure you look at your esophagus. Okay, so we're going to isolate the esophagus. And then also the teeth. So let me go ahead and open up here. We'll do the teeth again next time. But, okay. He's dead already though, so I promise he's okay. Okay, so just to point out a few structures. Okay, you see the roof of his mouth, right? The palate, hard palate and soft palate. The epiglottis, which I think I may have mentioned last time. This is the opening to the nasopharynx. Right here you have the laryngopharynx, okay? And then right there is like the esophagus is right beyond that. Obviously the tongue, you can see some of the papilla on the tongue, okay? And then the teeth, they're in the jawbone, obviously. So this is the jawbone right here. So even though this is for next time, I'm just gonna go ahead and do it this time. I don't know if it's, I know the teeth is on for next time, but I'll just go ahead and pop out a tooth right now, so you can kind of see the structure. Okay, so that's actually two of his teeth. Okay.
Oh my god.
Alright, so obviously the teeth had not emerged yet, and I didn't get all of the root. Sorry about that. I didn't get all of the root, but this is be the crown, would be the white part. The root, or part of the root, is that reddish part, okay? And then the rest of the root would be down here, the actual mushy part of the root, which of course I couldn't get because that broke. Okay, so that would be the, that's the enamel, basically, is the white part. Okay? Yes? Okay. So then in here, we're looking for the esophagus. You might have to switch to a different pig if this is not coming out quickly enough. Okay, there we go. Okay, so you can see this right here. This, of course, is your trachea. It's a review. Okay. You know that's going to be also on this part of the exam, the larynx and the trachea, because that's technically part of your respiratory system. And then right here is your esophagus. Okay, so the esophagus, soft. Okay, it's obviously not going to have any cartilage rings to it. It's going to be flat. Looks color-wise like pretty much everything else. That's your esophagus. Okay? That's the esophagus. Notice that it's a little bit behind the trachea, a little bit to the side, so it would be postero and lateral, right? So posterolateral. Okay. Alright, so that's your esophagus. And then we go into the abdominal cavity, which I want to make sure we identify, right? This is the liver. Okay, this one here. The gallbladder is going to be on the underside of the liver, usually the part that's kind of softish, right there. Okay, you can usually see it. It's greenish. It has a greenish tint to it. Okay. See that it has a greenish tint to it. Yes.
So the gallbladder is fused to the liver.
Yeah, to the underside of the liver. Okay. This is the stomach. Right here. Okay. Below the stomach is the spleen. Okay. The spleen is part of your lymphatic system, but you just want to make sure that you know it, because there's very likely going to be a pin on it. Okay. Although I think we did the lymphatic system already, but okay. So this is the stomach, and then if you go follow the stomach just a little bit more, okay, just beyond the stomach. So this whole structure right here is the stomach. Just beyond the stomach is going to be your pyloric sphincter right in here. And how you know is if you have gloves and you want to touch it, it's kind of hard. Okay. And then the this is going to be your small intestine now. So since this is a part that comes right off of the stomach, you know this is your duodenum. Okay. So if I were to put a pin here and you were clearly can see the stomach, then you know that's the duodenum. And I want you to be as specific as possible. Okay, we're going to break some of this connective tissue that's right here. Okay, and then behind, that's going to be part of the peritoneum. Behind it is going to be the pancreas. Okay, do you see the pancreas right there? Okay, this chunky stuff right there.
The light green stuff?
Yep. It's not always going to be light green, but in this one it is light green. But do you see that? Really pretty, actually, in this model. Do you see that? Gorgeous. That's the pancreas. Notice, again, glandular tissue, kind of chunky looking, like chewed chicken. Okay? Or chewing gum. Okay, so that's your pancreas. And your pancreas goes all the way back here, and that's going to be the tail all the way over there. This is going to be the body, and this part that curves right here is the head. Notice that it's right there close to the duodenum, because that's where it has its little duct, where it's going to release the enzymes into the duodenum. That's where you will receive your enzymes, your pancreatic enzymes.
Okay. And the pyloric sphincter is behind it.
Yeah, the pyloric sphincter is going to be right at the end of the stomach, right before it, yes. Okay? I can cut it open so you can see the pyloric sphincter. Okay. Okay, do you see that bubble right there? Mm-hmm. That is part of the pyloric sphincter. Okay. Okay. And then your pancreas back here. Okay. This is going to continue. This here is your small intestine. I know that it has blue stuff on it, but forget the blue stuff. What I do want you to note is that I want you to note and see that you can see the mesentery. Do you see the mesentery? Okay, that's the pink lines that do this. That's all mesentery. Okay. It's really kind of nice. Okay. So all of this is small intestine. See, still has mesentery. That keeps, remember, mesentery is the connective tissue that basically keeps everything kind of organized. Okay. Now, this is the large intestine. This is the spiral colon of your pig. Okay. But I want you to note. Okay, this is still your small intestine. This is the end of your small intestine. Okay, right here. So this would be your ileum. This is the cecum. Notice that enlarged area right there. That's your cecum. This here that sticks down, that's the appendix. Okay, so that is the appendix. So this is the ileum. Okay, this is the cecum, and this is the appendix. Do you see that? Okay, now right in here is you're going to have your pyloric valve. Okay, right in there. And I'm not going to cut it open because you're going to see just a bunch of green stuff come out. Okay, yeah, pyloric valve. And it'd be better to point out on a human model. Okay, on a model of a human. This is your cecum, your appendix, and this is your ileum. In case you see where all of those meet there. This might be something that we might want to, clean out a little bit because it has a bunch of the brown chunky stuff.
So
is your blood, the blood that's spilled out.
On the practical, if you would ask with a pyloric valve, would it be like an opening?
It would be very clear. It looks like a V, like this, into the cecum. Okay. So it's very easy to see on a model. Super easy. Okay. So it would be on a model. All right. Spiral colon. This here's the rectum. Okay, down back in there, the green one. Okay, that's the rectum. And then the anus is right there. Okay. So that was your digestive system, starting with the mouth, yes? Did I miss anything? Teeth, well, the tongue. I mentioned the tongue. Yeah, I think so. Do you want me to do it on the other pig, just in case? Since that one's a little dirty.